My name is Betsy Sheldon, and I'm a second semester nursing student. Today I'd like to talk to you about infertility, and specifically polycystic ovarian syndrome, which is the most common hormonal disease causing infertility. Why I'm interested in this: I myself was diagnosed with polycystic ovarian syndrome, or PCOS, about 4 years ago. I went in for my yearly physical and had explained to a new doctor, because we had new insurance, some of the symptoms that I've had my whole life, and she decided to do a ultrasound, which no other doctor has, and found over 30 cysts in each of my ovaries. And so at that time, my husband and I are actually trying for a baby, and that led us on our infertility journey. So today, I have 3 objectives I'd like to talk to you about PCOS. Our first one is a young adult will be able to correctly describe symptoms of PCOS and independently after the nursing student's brief presentation. After a short demonstration, the young adult will be independently and correctly measure her own basal body temperature, or BBT, before she physically gets out of bed every morning. And third, a young adult will be able to change her behavior regarding her food choices and exercise habits 100% of the time with help from the nursing student while cooking, and help her learn some new exercises. Some symptoms of polycystic ovarian syndrome are polycystic ovaries. They are enlarged ovaries that contain small collections of fluid called follicles, infrequent or absent periods. A person with PCOS might not get a period at all, or a few. Excess hair growth, because people with PCOS have a higher testosterone level. They have excess androgen, which is a male hormone, and you can get hair on your chin.
And got it.
Or other places that men normally have them. Another one is acne. Normally, people with polycystic ovarian syndrome, their acne is not just regular pimples, they're actually like boils, and they're really painful. And of course, obesity. The majority of women with polycystic ovarian syndrome, about 90%, are obese, and about the 10% are of normal weight. Women diagnosed with PCOS have an increase for developing type 2 diabetes, high blood pressure, high cholesterol, depression, anxiety, and endometrial cancer. The one with endometrial cancer is because you don't get a normal period and you're not able to shed that endometrial lining every month. One way we can help our bodies is by eating well and exercising. Some foods that people should eat for a long-term weight maintenance. This is one way you can manage your symptoms, is by eating a low glycemic diet, which includes
Beans, almond milk, Greek yogurt, berries, peaches, corn,
and many more. It's a quick search on Google if you really want to find out. Some low-carb, good carbs are meat, poultry, fish, eggs, and cheese, preferably organic. High protein, salmon, chicken breast, eggs, nuts, and seeds. And there's some many of the same things which are really super good for you. And high monounsaturated fats like avocados, avocado oil, olive oil, peanut butter, nuts, and olives. And to avoid gluten. And gluten is a protein found in things like wheat and barley. High gluten foods are pasta, baked goods, crackers, cereal, and beer. These recommendations are for a person with PCOS to maintain their whole life to keep their side effects at bay. Keeping a healthy weight is the #1 way a person can decrease their chances of diabetes, heart conditions, obesity, and increase their chances of ovulation and conceiving. A question that somebody trying to get pregnant might be asking someone with polycystic ovarian syndrome is, am I ovulating? One super easy way is by monitoring your ovulation by taking your basal body temperature, or BBT. Some pros about it is that it's inexpensive, way cheaper than ovulation kits that get really expensive month after month. It's easy. It can tell you many things about your body. It tells you if your luteal phase is sufficient enough for pregnancy. You normally want 12 days or more. And it tells you the day that you ovulate. And it also maximizes your chances for getting pregnant. Now I'm going to show you how to take your basal body temperature. Now that I've demonstrated, let's see how you take your basal body temperature. All of this information may seem overwhelming, but it doesn't have to be. Living with PCOS is a lifelong commitment to your health. You need to take care of yourself to be the healthiest you can be, and especially if you want kids. Being and staying healthy worked for me.